Hello, my name is Lingfeng Luo. I'm a third-year postdoc in Dr. Nick Leeper's lab. Today, I'm going to present our project on cancer incidence and the diagnosis of abdominal aortic aneurysm. So epidemiologic and mechanistic data support a potential causal link between cardiovascular disease and cancer. Abdominal aortic aneurysms represent a common form of CVD with at least partially distinct genetic and biologic etiology from other forms of CVD. The risk of cancer and how this risk differs compared to other forms of CVD is unknown among AAA patients. We conducted a retrospective cohort study using the IBM MultiScan research database to test whether individuals with AA have a higher cancer risk independent of traditional shared risk factors. So in the current study, we enrolled participants at the age of 18 years old or older with at least 3 years of continuous coverage between 2008 and 2020. Those with potential Mendelian etiologies of AAA, aortic aneurysm with non-specific anatomic location or a cancer diagnosis prior to the start of follow-up were excluded. And then a subgroup analysis was performed of individuals having the health risk assessment records. In both the main cohort and the subgroup cohort study, we compared 3 groups of individuals. The first group with AAA, the second group with non-AAA cardiovascular disease, and the third group is healthy control without any CVD. Here shows our cohort derivation. This table shows the demographics of the propensity matched cohort in the main study. And this figure shows a cumulative incidence of cancer risk among those with AAA, with non-AA CVD, and those without any CVD. So the 5-year cumulative incidence of cancer was 13.1% in AA patients, and it's 10.1% in those with non-AA CVD, and 9.6% in participants without any CVD. Our multivariable adjusted Cox proportional hazards analysis also showed that the patients with AA had a statistically significant higher cancer risk than those with non-AA CVD. The hazard ratio is 1.28. And AA patients also had a higher risk of cancer than those without any CVD. The hazard ratio is 1.32. And to determine which cancers were most associated with the presence of an AAA, we examined the association between AA and individual cancer subtypes. This table shows that compared to those with non-AAA CVD, AA patients had a numerically higher risk of most types of cancers. And then we limited the analysis to the subgroup of patients with health risk assessment records data, because this cohort includes information on self-reported tobacco use status and the BMI. And here we found the 5-year cumulative incidence of cancer was 8.7 in individuals with AA and 7.2 in participants with non-AA CVD, and 4.6 in individuals without any CVD. So overall, our data find that patients with AA may be at higher risk of cancer than individuals with other types of CVD, and those individuals without any CVD. And this finding was consistent even after we controlled for the shared risk factors like tobacco use status and the BMI. So future investigations are needed regarding whether patients with AAA may specifically benefit from focused cancer screening regimens and also into the potential interacting biological mechanisms of AA and the cancer. Thank you.